Hello, and today we're going to be talking about how to choose the right psychiatric provider. 10 signs of an excellent mental health prescriber. Choosing a psychiatric provider, why don't marry the first person you meet, and you shouldn't feel stuck if a provider isn't the right fit. So today I'm going to share what every patient should look for in a psychiatric prescriber and a few red flags to watch out for. Yes, your psychiatric NP is talking about dating. We all know first dates can be awkward. So the good prescriber, they listen more than they talk. They should ask questions. They should let you tell your story. If they interrupt you after 30 seconds, well, that's a problem. They explain why. Good providers explain why this diagnosis, why this medication, why this dosage. You should leave understanding the plan. They treat you, not just your diagnosis. Not everyone with anxiety needs the same medication, and not everyone with ADHD looks the same. Treatment should be individualized. They ask about more than symptoms. They want to know about your sleep, your trauma, your medical problems, your family history, substance use, stress, relationships, because mental health is bigger than a prescription. They discuss risk and benefits. Every medication has benefits. Every medication has risk. Every medication has possible side effects. You deserve to understand all three. And they welcome questions. A good provider doesn't get offended by, what are my options? Is there another medication? What happens if this medication doesn't work? Questions are part of a shared decision. They don't promise miracles. If someone says, this medication will definitely fix everybody, run. Psychiatry is rarely that simple. They have a plan. What happens next? When do we follow up? What should I watch for? Patients should never leave wondering. If your entire psychiatric appointment is, how are you? Fine. Here's your refill. See you in 6 months. Then we may have skipped a few important steps. So here are some red flags. They never explain medications. They never ask about side effects. They rush every visit. That's usually 15 minutes. That's not enough time. They don't review your medications. They don't listen. They make you feel embarrassed. They won't answer reasonable questions. And it doesn't include you in the decision making. And some green flags, they listen. They educate. They partner with you. They have a follow-up plan. They make you feel heard. And they explain why. And those visits are usually 25 minutes for med management. And if you're doing therapy and med management, usually 45 to 50 minutes. So in closing, remember, your psychiatric provider, they want to work with you, not on you. The best outcomes happen when patients and providers work as a team. Even better, here's some things that I wish every patient knew before their psychiatric appointment. How to choose a great psychiatric provider. What to bring to your first appointment. Questions that you should ask. What your psychiatric provider is thinking during your evaluation. What happens during a mental status exam. Why we ask about childhood. Why we ask about trauma. Why we ask about sleep. Why we ask about exercise. Why we ask about family history, why we ask about diet. The biggest mistake away is I wish patients knew the biggest mistakes patients can make and how to avoid them. It helps patients advocate for themselves without criticizing other clinicians. The qualities that you value as a psychiatric mental health nurse practitioner: listening, educating, shared decision making, and individualized care. That combination builds trust with patients while still being respectful of the profession as a whole. Thank you for listening. Don't forget to subscribe if you think this is something that you're going to like. And don't forget, be kind to your mind because mental health matters.